Hello, this is the internet channel TA Therapy. This is Bob Cooke here. Welcome. I'm going to continue talking about narcissism. I presented already 2 presentations on this channel. The first one was on the features of narcissism. The second one was on 2 types of narcissism. And this one is on the treatment of narcissism, and then the 4th one will be on the DSM characteristics of narcissism. So let's get back to this one. Treatment of narcissism. Yes, I'm going to look at the general treatment considerations for the narcissistic condition. And I'm going to outline Eleanor Greenberg's treatment plan, and also talk about how I see work in each of these stages. I'll be talking about Cohert's influence and Masterson's influence, but I'd like to take this plan as a sort of general framework in talking about the stages or sequences of a psychotherapy process with narcissists. Okay, so having said that, let's move on to the general treatment plan. Okay, we've got all these different stages that she talks about. First one's empathic attunement. Second, allow idealizing and mirroring transferences to unfold. Then to facilitate the understanding of how past and present connect. Then the recognition stage, working through stage, what she calls the lost paradise, and what Masterson calls self-activization, and so does Cohert. Okay, we'll go on from there and split it down then. So when we talk about empathic attunement, which is the first place with narcissists and probably the most important, I think, we're looking at Cohert's idea of empathic attunement, which really he talks about in many of his books. Cohert was the founder of self-psychology in the 1960s, talked a lot about empathy and the major transferences of working with narcissists and borderlines, but mainly talked a lot about the narcissistic condition. And Eleanor Greenberg, I think, draws a lot on Cohert's work. Very good place to go to, Cohert, to look at how to work with narcissists. So empathic attunement. So that's very much about actually coming alongside the client, getting into their psychic skin, asking clients, how was that for you? What were the feelings that you felt there? So instead of confrontation transactions, you need what Barbara Clark talked about in the TA world, empathic attunement. Also, Richard Erskine talks about empathic attunement, and I think Barbara Clark, Richard Erskine, Cohert all look at empathic attunement as central to working with clients, but most of all central to work with narcissists. So it's really, really important to find a way into their internal world, because confrontation transactions they will receive as humiliation and defend against that. So it's work with the child ego state. Tell me a little bit more about how you felt there. Wow, that must have been frustrating with you. So it's that sort of transaction, an empathic one, getting into their psychological skin, trying to work out what's happening for them at a feeling level. Okay, after you've got the empathic attunement, that should lead then to building up a good and positive working alliance, where positive therapy should happen. Next, then, once you've got the empathic attunement as a general framework for the work, we need to allow the idealizing and mirroring transferences to unfold. Now, those come from Cohert's work and the self-psychology movement, who talked a lot about idealizing transferences and mirroring transferences. So the idea is that narcissists particularly need to idolize you. They need to be able to actually really see you as special, which helps them feel themselves as special. And for a while, you might want to look at this as a sort of dependency phase, but it will pass, and they will, in inverted commas, psychologically grow up and work through this with you. But they need to be able to see you as very special and respect you in your work, and perhaps even a parent-child transactional dialogue needs to be fostered. Cohort specifically said that this would occur in psychotherapy anyway, and that it is a necessary part of child development, and that they need to idolize someone special they can look up to have an internalized other that will be there with them as they go to their darkest places. They also need to be able to mirror you and to be able to actually, I think, take that internalized other very much on board through the psychotherapy process. Okay, Cohort also said that the counter-transference for therapists at this stage would be that maybe they would feel overwhelmed, they would feel the client was very needy on them. So it's important to perhaps go to supervision at this time if that's hard for you, or in fact see this as a stage that they need to go through and that you need to foster, and that will happen and is important and vital and pivotal to the treatment of the narcissists. If you want to read more about this, please go to Cohort's work. He talks extensively about this. Next stage, or the third stage, now you've got the empathy working, transferences probably occurring. We need to look at how we can help the person connect past and present. Of course, this is key to most psychotherapy profiles, but with the narcissist particularly, because their level of empathy and self-reflection is very low, and usually their emotional literacy is pretty limited. The best way, I think, particularly here, is probably to use empathy, which Cohort talks about and Greenberg really sees as key to the work of narcissists. And I want to add two others, really from the relational integrative school of Richard Erskine, where he talks about using inquiry to be able to get a good empathic connection and feel attuned with the child of the narcissist. Okay, so we've got the methods of how to help the person connect past and present. So that then hopefully takes us to what Greenberg talks about as the recognition stage. So as they start to put past and present together, they'll become more aware of their narcissistic behavior and the narcissistic condition, which then takes us on to the working through stage. Now, once they've become aware of the narcissistic behaviors and the adult triggers, the next stage will be, do they want to go further into looking at changing this process, really experientially working in the past and connecting to the present in a more deeper way? Or do they want to leave therapy at this particular stage with their adult, probably more robust and cognitive processes more stable? They can, of course, and many do, if they want to really go deeper though and look at the experiential processes in the child ego state and healing at that level. They really need to have high motivation for this. They need to have worked out the adult resources needed at this stages to have a robust adult and be able to actually have the capacity to do this. And they need to be able to process feelings. If the motivation is there, there's enough adult capacity, and they are able to process feelings and connect to connect past to present, then on we go to the next stage of therapy, which Greenberg calls the lost paradise, which means letting go of the narcissistic defenses And to do that, you need to continue working through the child ego state feelings, get to the hurts, the losses, the emptiness, the feelings of real aloneness. This is where healing will really happen at an experiential level. And of course, dealing with the original loss, which is why they put the defense of the narcissist condition in the first place, so they didn't have to feel the awful feelings of trauma and loss of their self, really. So it's quite a difficult stage because it's so emotional and so grief laden, but it's really important. And also, what's really important at this stage is that the work also includes what the person is going to put in its place of the narcissistic defenses, which have helped them get through life so wonderfully. So it's quite a long stage, but a very pivotal one in the service of reintegration of the lost self. Next, we go to what Masterson and cohort called the self-activation stage. In other words, as they start to heal, start to be aware of the loss, working with the child ego state, integrating the past and present, integration becomes key in the search for what we would call proactivity. So they actually start doing things positively outside in their life as well as in the therapy process. Okay, so let's look at what needs to happen to self-activate. Sorry, what needs to happen is they need to start to take some of the behaviors, the new behaviors that they've reintegrated and worked through in the therapy process out into life. They often may feel worse at this stage in some ways as they start to experiment being proactive and self-activating and not making other people responsible for their changes and perhaps blaming them or actually flying into a narcissistic rage. And as they move to actually integrating these new decisions for life into their world outside the therapy session, they will feel better, more spontaneous, more freer, a new lease of life, and be able to work out the triggers at this particular stage more accurately. They'll be able to go down a new path in life and perhaps even take a new script on board. Hopefully, if they do all these three, there's this integration, they are proactive in self-activation and change, and they take new decisions for life on, they will have let the old script go and taken on a new one, which is all we can really hope for in a psychotherapy process. It's quite long work, quite slow and tedious in many ways. When I say tedious, I mean it's more, can be quite frustrating for the narcissist, and the therapist may get a sense of frustration with the slow, painstaking work that needs to be worked through during all these different stages. It's a very satisfying process though, and I wish you well in working with the narcissistic condition if you have got clients who present from this place. I hope this plan has helped you. It certainly helped me when I started to work through and think about how to work with narcissists. So best of luck, and finally, thank you. Thank you for listening to this presentation on how to work with the narcissistic condition. And I wish to acknowledge Eleanor Greenberg and James Masterson in some of the material that I've outlined above. Finally, goodbye, and my next presentation on narcissism, which I think is the fourth set of slides, is on how the DSM-4, that's the Diagnostic Statistical Manual, outlines characteristics of borderlines and talks about how to work with them. Not so extensively as Greenberg and Masterson do, and hopefully I've given some light into that. So best of luck with this, and goodbye, and I hope you come back to my internet channel where we continue this wonderful voyage through how to work with a narcissistic personality. Thank you, and goodbye.